I'd like to acknowledge the traditional owners and custodians of the lands from which we are taking part today, and pay my respect to their elders, both past and present, and to emerging community leaders. I also acknowledge the important role of Aboriginal and Torres Strait Islander people within our organisations and in the communities we work with. Welcome everyone. My name is Erma Ranieri, Commissioner for Public Sector Employment and the South Australian President for the Institute of Public Administration South Australia. I'd like to welcome the public sector, IPAA SA partners and supporters to our first instalment of the COVID-19 Mental Wellbeing interview series. I'd like to welcome you, Dr John Brayley, and thank you for being here today.
Thank you.
I'd also like to thank my office, the Office of the Commissioner for Public Sector Employment and IPAA SA, who have worked together to deliver today's event. We also acknowledge IPAA's major partners, the State Government of South Australia, Senior Management Council, PwC and Flinders University. We also acknowledge IPAA's professional members and counsellors. Before we go into our interview, I'd like to just give a brief introduction of Dr John Brayley. John has had the statutory appointment of Chief Psychiatrist since May 2018. During this time, the Office of the Chief Psychiatrist has led work responding to the Independent Commissioner Against Corruption's Oakden report and has developed an active program of unannounced inspections of mental health facilities. The Office has also worked collaboratively with Mental Health Commission to develop a mental health services plan for South Australia, which has been endorsed by Government. And I'll just add one more thing. John and I are also working closely together through the Issues Group for Suicide Prevention, supporting the Suicide Prevention Council, and in particular how we join up government. So welcome, John.
Thank you.
So let's get into the questions, and thank you to everyone who's posted some questions. It's a very important series. Can you just talk a little bit, John, about the work that your office is currently involved in for us to kickstart this interview?
Certainly. Our office has statutory roles and departmental roles. So the Chief Psychiatrist position is defined in the Mental Health Act, and we give advice about the mental health system, services, oversee the way the Act is used, how rights are protected. We conduct inspections, investigations, set standards. But in addition to that, we also have a role within SA Health. So it involves planning, policy setting, the work that you've mentioned for the SA Mental Health Services Plan. There's a whole range of activities that the office is involved in there. Thank
you very much. It sounds like you've got a lot on your plate. I suspect your office isn't that large either.
No, it isn't. But, yes.
We know that COVID-19, the COVID-19 pandemic is having a significant impact on people's mental health. And I think you can only sort of think about how you personally react to something that we're just unsure of. What are your thoughts on the impact of this to the South Australian community?
Yes, this has been an evolving picture, the mental health impacts of COVID-19. We often think of the public health aspect as the viral infection itself, and looking at the number of tests done, the number of people who require quarantine or whatever. But the public health aspect also applies to people's mental health. And since March, there have been some significant factors that have affected our mental health as a community, and affected some subgroups more than others. Initially, when the outbreak was developing, we were looking back at the research that had been done following past outbreaks. In particular, the first SARS virus in the early 2000s, there were mental health follow-up papers from Hong Kong and Vancouver, and they focused on what happened to people if they had the SARS infection in terms of mental health sequelae. And in some of those papers, up to half the people who had an infection could be developing anxiety, depression, or post-traumatic stress disorder. So we need to be mindful of that. It doesn't mean that people will become unwell, but we just need to be mindful of the possibility if people have been very sick that there can be mental health consequences. And from that research, the issues of fear of the virus, I think that's something that has affected everyone, and stigmatisation from people who do have an infection were predominant factors. After that, the question of isolation, whether it was from quarantine or people staying at home, became a major factor, and it still is a factor currently. The impact of isolation, loss of social connections, potentially working from home on people's mental health. And now currently there is a particular focus on the economic impacts of the public health measures, so the impacts of unemployment, financial stresses on people's mental health. So for all of these reasons, we know that we need to take action. So sometimes when you look at some of the projections and the potential impacts, it seems pessimistic, but we know that through good health advice, early intervention, if people are starting to get symptoms, getting people to seek help early rather than waiting until they become more entrenched. Through all of these measures, we can make a difference in helping prevent the more serious sequelae of mental health problems related to COVID.
We can probably get onto the question of symptoms as well.
Yes.
Are you seeing mental health services at the moment in South Australia? Are they seeing an increase in demand? Do you have a line of sight of that?
Yes. Yeah. Well, just as the public health measures with the virus need to be data-driven, our mental health responses need to be data-driven. So each week we look at what's happening in South Australia and with our services. Now, interestingly enough, during April, there was actually a decline in service use, but that's picked up again. And currently, with our own telephone lines, we're seeing a 10% increase compared to 2019 levels. And also in ED presentations, emergency department presentations for mental health or drug and alcohol problems. So it is having an impact that can be measured. Nationally, the Beyond Blue line has had about a 24% increase. We learnt at the Beyond Blue board meeting this week. So they've been experiencing this increase, and it's good that people are seeking help.
Mm. Is that quite a high percentage of increase, considering like to jump from 10% or 24%? Is that a worrying thing?
Yes. Well, I think. For some of the helplines, the increase was already there after the bushfires, and it's sort of built on that with COVID-19. The lines that, for example, in South Australia we have the SA COVID Mental Health Support Line, and the emphasis on that line is actually delivering support. So we don't want people to wait until they're at a point of crisis to call and speak to counsellors. We'd prefer to get calls earlier, and the services have been set up to provide follow-up. So it's not just a one-off interaction. If you need to have regular calls afterwards, you can receive them.
That's great. What do you recommend people to do to protect? So you said early intervention or seeking support early. If people want to do something early on in the piece, what would you recommend that they do to protect their mental health and wellbeing at this particular time?
Yes. Well, I think you'll see on the SA Health website and the various links, we have a number of brochures that have been developed to look at that very issue. There are three main areas that have been focused on in terms of people at home. One is routine, the second is physical exercise, and the third is social connection. And they're just very simple, practical things that we can all do. So if people are working at home, to be able to have a clear routine of leisure and work time, that is important. To be clearly able to schedule in, activities with family. There may not be the same range of activities, but of course our community is opening up at the moment, so there are more things to be able to do now. Physical exercise is so important because we've known for at least 20 years about the benefits of physical exercise on mental health. The same sort of exercise that is good for your heart can be good at dealing with anxiety symptoms or symptoms of depression. It has similar impacts to the catecholamine chemicals in the brain that modulate mood. So keeping physical exercise up is a significant thing, and something that can be so easily lost, particularly in the colder weather, being at home, whatever. And then social connection. So if people's, whether it's connection with family, friends, colleagues, the importance of just spending the time to actively speak to people via video, telephone, whatever, are significant things. If people are starting to feel anxious or sad, or their sleep is affected, persistent headaches, appetite, energy, concentration, heart racing, whatever. If symptoms persist, it's better to find out what it is and seek help. And if so, there might be sort of cognitive symptoms. People are worried, mulling over things, or feeling hopeless, or even just general physical symptoms. Encouraging people to get help early is an important strategy.
Is it natural to be feeling, I guess, slightly sad? You mentioned sad, and I think because it's the unknown, that some people have actually described that they've actually felt quite tearful, but it didn't persist. Is that quite a natural reaction to things that you're uncertain of, and you get over it and you have your moments? So it's almost a bit of a roller coaster ride at the moment.
That is quite a natural reaction, and it's the persistence or the intensity of the symptoms that might lead people to seek help. So in general, the focus in providing assessment, care, therapy, treatment is on distress and disability. So if people are feeling persistent distress, it's good to seek help. If there's a disability, so people just can't do what they would normally like to be able to do because they're being held back by anxiety or a loss of energy or whatever, that's another reason for seeking help.
Sure. Some good messages there for leaders as well. So I think the bit about communicating is a message, I think, that for anyone who is a leader and listening to this, it's really important that they reach out to their people no matter where they are and as often as they can.
Are you okay?
That's right.
That's right.
I've got to ask you this. How does someone like yourself look after yourself? So you'd be really busy during this time. So are you actually practicing all the things that you've talked about? What does a psychiatrist do to relax during this time?
Yes, indeed. One tries to follow the same general advice that giving everyone else, and it really does highlight the challenges. Like, it's simple advice. It's important to be able to talk to family and colleagues and to maintain routine. But I'm one of these people who is a fan of wearable devices to check the fitness. So
I think we both got one, yes. So that's great.
those sorts of strategies help. Like a lot of people, I've found working from home and using Zoom and Teams, quite tiring. Like a 1 or 2 hour video meeting seems to be much more tiring and have a greater impact than sitting around a table. So I'm still adapting.
It's a good point. I think
Yes.
we're all saying that. And those of us that are sort of more social and like to see people, you can't get that extra kind of connection with people through the Zoom or the Teams meeting, but I have actually found it efficient. It actually flows on to the next question. Many people have now been working from home for more than 2 months, and that's full time. So I think some have love it, others may not. What are the potential pros and cons for mental health and working from home? I think you've mentioned a few,
Yes.
and that is the routine and other things. Any other tips, things that you'd actually want to comment on in relation to working from home?
Well, certainly. I think it's important that you mention the pros because I think after this period we will be set up to enable home working, and I expect many people will still wish to be doing at least some of their work at home because those obvious practical benefits, not having to commute, to spending more time with family, there's a clear improvement in lifestyle from those factors. I think the question of boundaries, I mean, people are working really hard at home, and the boundaries between work and home time and family time has been a significant issue. Isolation, having important communication over video links, sometimes really sort of important, discussions about welfare and things like that. It is harder to do it over video than in person. So I think we're all still adapting to that and need to just be mindful of both the benefits and the limitations of home working.
Going forward then, a combination of both could be the best of all worlds. So what the next or the new normal might look like for mental health in particular, and the new way of working could be a combination to make sure that we don't allow people to sort of not have that contact, but enough time to be able to do the other things in life and to balance. I guess I've seen a lot of people become very productive working from home, and we've taken so many hours off their commute.
That's right.
As well.
That's right.
Yeah.
That's right. I think so. I expect that combination will be far more common in the future.
And as someone who's always talked about flexible work arrangements, I think it actually will start to give us some idea about what we might do for people that are disadvantaged, particularly people with disabilities, and how we can actually change the way we work to adapt things for everyone depending on their sort of abilities to do work in different ways.
Yes. I think the flexible hours, the location, they've all been positive advantages. In our office, we had our structures and systems set up to do our usual business, and we quickly had to transform to respond to the mental health aspects of COVID. So in the core staff group, there's about 25, 26 people, and with other staff from other parts of the department and Wellbeing SA, the Premier's Advocate's Office, we formed these lines of effort looking at areas like community mental health care, inpatient care, sustaining workforce, NGOs, liaising with the SA Command Centre, providing mental health support for them, legislative aspects. So we had to restructure very quickly for a period of time to get a lot of work done, and incredibly, it was possible to do that while doing it on a video platform as well. So this period of COVID, which is it's a disaster that has had a great effect on our economy and people, but it's shown us that we can do things very quickly, and the level of flexibility in our public sector structures to change things that we might not have been aware of if it hadn't have been for these dire situations.
I agree, and I am so proud, I think, of how the public sector's responded. And in particular, my next question is really around our frontline people, and they are public servants as well. So as a community, I know that we're all grateful for their ongoing support and services, frontline staff at this particular time. But it must be challenging for those people, especially at the height of the pandemic. What are your thoughts on how our frontline workers can look after their mental health?
Yes, that's right. There's responsibilities on our frontline workers, as there are on us all, to look after our mental health. But there is a particular responsibility for leaders in organisations to be mindful of their staff's mental health. And interestingly, when we were looking at this as part of the initial response, it's often the practical way teams are led and supported, the transparency of information, having sound systems in place. And this is particularly, I guess, for the frontline people who might be exposed to a person with COVID-19, the access to personal protective equipment, and so organisation, communication, structure, like any frontline areas, whether it's health or transport or law enforcement or corrections or social services, whatever the frontline area, having managers that are alert to their staff needs. It's a textbook issue, but it is very clear cut. So that if when we hear stories of people who have experienced PTSD or other conditions, it's often that first contact with their manager that is critical, and how well that goes, and how they're understood, supported, responded to, and being a manager in that situation can be very challenging, because the managers themselves may be facing the same sorts of pressures or potential threats in terms of, say, the virus situation. So it's really incumbent on managers and leaders to look at how they might respond, how they might listen, and whether or not they feel that they might need some extra training, like mental health first aid or some other program, just so that when the time comes, and it could be 4 o'clock on a Friday afternoon or whenever,
it always is.
It always is. They'll feel ready to respond. So practical arrangements, management response. Clearly we have strategies that have been shown to work, such as peer workers, peers in workforces, and EAP programs.
Well, in fact, the response to the I Work for SA survey, the response around training up peer support officers commenced, and it's actually been really quite a useful network of people that are trained and are at the work site to assist that have the skills to deal with that very first phone call. So talk to me a little bit more around why that very first sort of contact with someone that actually is in the same field, in particular if you're a frontline officer, someone who's been through it, so peer support to me is someone who actually is like you, that may have gone through it and then might give you some counselling. From your perspective, what difference will that make for that person's sort of longer term mental health if you got it right there?
Yes, well, from what I've heard from people over the years, there is just something different in having a peer in your workplace who actually knows the workplace, knows what you're dealing with, has had to deal with similar issues themselves, being able to respond and provide support. So as relevant and significant as mental health professionals are, and people do need to seek professional care, there is something that peers can provide that a professional can't, and at times people might just need to speak to a peer, and that's all that's required. But even if people are seeing a psychologist or some other form of counsellor, to be able to talk to a peer as well is valuable. So they're there, they understand. The peer has had extra training, and this has been particularly noticed in emergency services, that the peer programs, in addition to EAPs, are significant benefits, and it's really good to see it being expanded through the public sector, and it's an important frontline response at the moment.
It is.
Yes. That's right.
We have now together managed to get an extra 120 peer support people that we'll be training over the next little while, and certainly for our frontline workers, an increase in the number of EAP sessions. Did you want to say anything about
Yes.
that support for public sector workers?
Yes, indeed. Well, this was all part of the overall mental health response package, this virtual support network. So there's many other elements to it, for people in quarantine. There's a drug and alcohol component, but it was obviously very important for frontline workers to be supported, and it was in that context, of course, that your office and my office sat down and looked at what could be done, and what could be done relatively quickly in terms of the evidence that works, and the expansion of the peer program, and giving people just 2 more sessions with their EAP provider. They were 2 practical things. So if people do need more therapy or support, they can be referred to a private therapist, psychologist. But just a couple of extra sessions just might make the difference in ensuring that's a smoother process, or for people who don't need referral, that they've just got a little bit of extra time. So this package, which is going to go until September the 30th, is part of that immediate response to mental health needs.
I think it's going to be very well received by a lot of people that are probably sort of thinking about whether they need to get a few more supports, so they're there. So thank you for working with my office on that. A couple of more questions from that were posted by the audience. How should we help a colleague or a friend we're concerned about? What can we do if we're concerned about someone else's mental health? So we kind of we can see that they might be struggling, but they may not be able to see that. In particular, there's some tips for leaders. What are some of the signs, or how can you do it in a way to not offend or whatever, but at the same time to, I guess, extend the hand so it doesn't get any worse?
Yes, yeah. Well, I think being prepared to listen in a non-judgmental way, and also asking people if they are okay, and trying to create just a period of time where it's possible to speak privately to a person, just to check on how they're going, and if there's anything that a colleague can do, or that a manager or line manager or leader can do to support their staff member, and that preparedness to talk, to listen. Not necessarily to give advice, but just to listen and look at options, and then help the person find care if that's necessary as well. It's often a good thing a little while after, just to check that after that first conversation, to have another one just to check that the person is going okay, or if they are going to their GP or to the EAP, that they've been able to do that and had a satisfactory response.
Great tips there. What would it take for our social and government systems to flip the greatest focus to prevention of mental health distress rather than clinical treatment? Now, you've given us a lot of tips, but often it gets really to the point of needing clinical help. And I think a lot can actually happen before that. So what will it take to sort of change that around? And I think you're doing some great work to do some of the preventative stuff.
Yes. a lot of what we've been talking about today has been prevention and practical steps. I think in our community and in our workforce, an awareness of the importance of well-being and taking positive steps to look after one's own well-being and having one's work routine and life being able to support that becomes quite significant. So and it's, as we've been talking about, it's often how, for example, work is structured, people are supported, that can enable this. And sometimes, though, people may need to actually do some form of well-being program. You don't necessarily need to be having symptoms to benefit from doing a structured program, and there are a number of those sorts of programs that are available. In terms of general activities, the Open Your World website that has been launched by Wellbeing SA is a very useful resource.
It's great, yeah.
And the importance of of Open Your World is that it's about health wellbeing, but it's not a health website in the sense that it's whole of government. It's looking at all of the areas of government and how they can contribute. And there are a range of links, obviously, to specific health resources that people can look at.
It's a great website, so yes. The final question, there's a lot happening in the world at the moment, and it almost seems like it's sort of turning itself on its head. There's a lot of really great things that we've learned, but there's some really not so great things actually happening as we've gone through the pandemic and just all the other things, economic downturn and the rest of it. If you look forward, or we'll have a crystal ball or whatever, how can we cope? What sort of advice would you give any individual, no matter how strong or resilient you are? It's actually really tough to be watching the sorts of things that are happening, people losing their jobs, the sorts of kind of things that are happening across the world. Any last bit of advice in terms of how we might just cope with some of that? It can be quite distressing, and I know that when I see it myself, I kind of go, this is what's happening to the world. So, now that we have a psychiatrist here, what advice or tips can you give us going forward to try and cope with all the things that are coming our way, and how can we make it better?
Yes, that's the whole question of resilience and building our resilience. In spite of many of the concerns that I've been talking about today, we are resilient. I mean, people through this hardship and adversity, I think people are finding out new strengths about themselves, having to reappraise and revalue what's important in their life, So this we still don't know what is going to finally happen with COVID-19. There is more time to wait yet, and other events are occurring in the world. But I think for all of us, that question of self reflection. Looking at family and contribution to the community and to others are all of the sorts of positives that can come out of a difficult time, and also no one is superhuman. So if there is if someone has signs of anxiety or depression, then these are the sorts of things that can be worked through, or other mental health conditions, because the fundamental issue is the maintenance of hope, and hope for individuals and communities that we will get there, and thankfully. So far with our public health measures, the situation is a lot better than we were thinking it was going to be in April, and the same sort of positive thinking can be applied to looking after our mental health.
Thank you so much, Dr John Brayley, and I love us leaving on the note of hope.
Yes.
Thank you for being here.
Thank you very much. Thank you.